Why do I still have odor despite good hygiene? Sometimes, even when you are diligent about washing and keeping clean, you might notice a persistent smell that just won't go away. This can be confusing and frustrating, but understanding the underlying reasons can help you address the issue effectively. Good hygiene mainly focuses on external cleanliness, but odor can originate from inside the body or be linked to medical conditions that hygiene alone can't fix. One common cause is urinary tract infections or bladder infections. These infections happen when bacteria like Aerococcus urinae or others colonize the urinary system. They can cause foul-smelling urine or a strong odor around the genital area. Sometimes, the only sign might be the smell itself, especially in early stages, before other symptoms like pain or changes in urination appear. These infections need proper medical diagnosis and treatment with antibiotics, as hygiene alone won't eliminate the bacteria. Dehydration is another factor. When you don't drink enough fluids, your urine becomes more concentrated with waste products like ammonia and urea. This concentration makes the urine smell stronger and more pungent. Drinking enough water helps dilute urine and reduces odor. It's a simple but effective preventive step. Diet and medications also influence urine odor. Foods such as asparagus or coffee contain compounds that are processed and excreted through urine, changing its smell. Certain medications can do the same. These changes are normal and usually temporary, but they are not related to hygiene practices. Bacterial imbalance or colonization can also cause persistent odor. Sometimes, even with good hygiene, an overgrowth of bacteria in the genital or urinary tract can produce a smell. Using harsh soaps or excessive cleaning can disrupt the natural balance of bacteria, leading to odor issues. Maintaining gentle hygiene and avoiding irritants can help keep the natural flora healthy. Rare metabolic conditions like trimethylamine, also known as fish odor syndrome, can cause body fluids including urine to have a distinctive smell. These are inherited conditions affecting how the body processes certain compounds, and they are unrelated to hygiene. Persistent odor might also be a sign of underlying medical issues, including bladder problems or even bladder cancer. While odor alone isn't enough for diagnosis, if it continues despite good hygiene and is accompanied by other symptoms like blood in urine, pain, or changes in urination, it's important to see a healthcare professional. They can perform tests like urine cultures to identify infections or other issues. To manage odor related to bladder health, staying well hydrated is key. Drinking plenty of water helps keep urine diluted and less smelly. Avoid using harsh soaps or scented products that can disturb the natural bacterial balance. If odor persists or worsens, especially with other symptoms, consult a healthcare provider promptly. They can evaluate for infections, metabolic conditions, or other urinary tract issues that might need treatment. In summary, persistent odor despite good hygiene often points to internal factors like infections, dehydration, diet, or metabolic conditions rather than external cleanliness. From a bladder health perspective, any ongoing or unexplained odor should be checked by a medical professional to rule out infections or other urinary problems. Remember, everyone's body is different, and personalized medical advice is always the best course of action.